So here are eye disorders. This is going to go into your HBS course file. And so I have 6 of these on this page with the disorder on the outside and then information underneath. Okay, so first we have conjunctivitis. Conjunctivitis is also known as pink eye. This can be due to a bacterial or viral infection. Conjunctivitis is due to an infection of the conjunctiva. Symptoms, you're going to have, your eyes are going to be itchy, red, and watery. Treatment would be an antibiotic or antibacterial eye drops if it's a bacterial infection. So treatment would be an antibiotic, so medication that you would take orally, or antibacterial eye drops that you would put directly in your eye if it's a bacterial infection. Okay, next. All right, next, we have onchocerciasis. Onchocerciasis. I gave myself a little pronunciation guide. Onchocerciasis. So onchocerciasis is called river blindness. There is a parasitic worm from the bite of black flies. So you get infected by a parasitic worm when you get bitten from black flies. So this is a parasitic infection. You have impaired vision / blindness from recurring conjunctivitis, so over and over again conjunctivitis. You have infection of the cornea, sclera, bumps on the eyelid around the eyelashes. So you have to have a antibiotic once or twice a year for 10 to 15 years. Ivermectin. So onchocerciasis, river blindness, parasitic worm from the bites of black flies. It's a parasitic infection. Oh, and I think I said antibiotic. That's an antiparasitic, not antibiotic. This is a parasitic infection. Antibiotics aren't going to help with this. Symptoms, impaired vision / blindness from recurring conjunctivitis, infection of the cornea, sclera, bumps on the eyelid or around the eyelashes. So you need a antiparasitic medication, ivermectin. You have it once or twice a year for 10 to 15 years. All right, next. Subconjunctival hemorrhage. Subconjunctival hemorrhage, that's an E. Subconjunctival hemorrhage. So you have broken blood vessel that's under the conjunctiva. Possible cause can be from injury, high blood pressure, inflammation. Sometimes it's just no really good way to pinpoint the cause. You have a bright red spot or a patch in the sclera. It's usually harmless and will heal on its own. So, subconjunctival hemorrhage, broken blood vessel under the conjunctiva. Possible cause would be injury, high blood pressure, inflammation. Causes a bright red spot or patch in the sclera, and it's usually pretty harmless and will heal on its own. Next. Okay. Next we have loiasis. Loiasis. I gave myself a little pronunciation here. Loiasis. Okay, so loiasis is the African eyeworm. It is from the parasitic Loa loa worm and from bites of deer flies or mangrove flies. This is a parasitic infection. The symptoms would be joint swelling, itching, pain, fatigue. We have that little eyeworm parasite. Treatment, the eyeworms require surgical removal and then antiparasitic meds. All right, loiasis, the African eyeworm, is from the parasitic Loa loa worm that you get infected with from bites of deer flies or mangrove flies. It is a parasitic infection. Symptoms would be joint swelling, itching, pain, fatigue, and the little parasitic eyeworm. The eyeworms require surgical removal, and you need antiparasitic meds. Next. This one is traumatic iridodialysis. Traumatic iridodialysis. This is this is caused when blunt trauma causes the iris to detach from the ciliary body. So the iris detaches from the ciliary body. This is an eye injury. You can end up with symptoms of an irregularly shaped pupil, eye pain, and blurry, impaired vision. To correct this, you need surgery and eye drops to prevent glaucoma. So, traumatic iridodialysis is blunt trauma disease, or blunt trauma issue, causing the iris to detach from the ciliary body. It is an eye injury. Symptoms are irregularly shaped pupil, eye pain, and blurry, impaired vision. In order to treat this injury, you need surgery and eye drops to prevent glaucoma. And finally, we have trachoma. Trachoma is a bacterial infection in areas without clean, safe drinking water and sanitation. Right? Trachoma is a bacterial infection. The symptoms would be visual impairment / blindness from cornea damage. You treat trachoma with surgery, antibiotics, good hygiene, wash your face and hands really well, and then have access to better sanitation and clean water. So trachoma is a bacterial infection in areas without clean, safe drinking water and sanitation. Symptoms of this bacterial infection are vision impairment / blindness from cornea damage. To take care of this infection, we need surgery, antibiotics, good hygiene, washing your face and hands, and then access to better sanitation and clean water.